Hello, everyone, and thanks for listening today. This is the RX Daily Dose. Today's episode is being recorded on Wednesday, October 2nd, and I'm your host, Ian Parnagoni. I think I mentioned in the first episode that I travel for work. I'm actually recording this episode early this week since I'm traveling the rest of this week. We update this podcast every week for healthcare providers, medical professionals, and anyone who's interested in drug updates. Don't forget to like, share, and subscribe on all of your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. Let's start, as always, with updates from the FDA. On September 26, the FDA expanded the approval of glecaprevir biprentasvir tablets. That's brand name Mavyret, made by AbbVie. Under the expansion, the tablets are now approved for an 8-week duration of therapy for treatment-naive children ages 12 years and older and adults who have chronic hepatitis C virus genotypes 1, 2, 3, 4, or 6, and with compensated cirrhosis. This follows the recent approval about 3 weeks ago of Harvoni and Sovaldi for use in younger patients as well. Harvoni and Sovaldi are both indicated for patients actually as young as 3. However, they are only for specific genotypes. This puts Mavyret as the first 8-week treatment approved for all treatment-naive adults and children over the age of 12. Standard treatment length for patients was previously 12 weeks. The most common side effects are headache and fatigue, and Mavyret is contraindicated in patients with moderate to severe liver impairment or those with a history of liver decompensation. Also on the 26th, the FDA also approved a new indication for daratumumab, brand name Darzalex, by Janssen Pharmaceuticals. Darzalex is now indicated in combination with Velcade, thalidomide, and dexamethasone. A regimen is called VTD, for treatment of patients with newly diagnosed multiple myeloma who are eligible for autologous stem cell transplant. There are now 3 different treatment combinations that include Darzalex for patients who are newly diagnosed with multiple myeloma, including 2 previously approved regimens indicated for patients that are ineligible for an autologous transplant. Multiple myeloma is a type of cancer that forms in plasma cells. The cancer accumulates in the bone marrow and essentially crowds out the healthy cells. Initially, patients are treated with induction therapy to reduce the number of plasma cells, and patient stem cells are collected. Patients are then treated with high doses of chemotherapy. The high-dose treatment kills the cancer cells, but it also gets rid of the blood-producing cells that are left in your bone marrow. Afterward, the collected stem cells are put back into your bloodstream, allowing the bone marrow to produce new blood cells. Patients then continue with the next phase of therapy called consolidation, where they continue to receive Darzalex and VTD to kill any cancer cells that may be left. Some studies with Darzalex are still ongoing. However, there was a 9% increase in complete response versus therapy without Darzalex. The FDA also approved the new indication for another product by Janssen Pharmaceuticals, that's canagliflozin, going by brand name Invokana, to reduce the risk of end-stage kidney disease, worsening of kidney function, cardiovascular death, and hospitalization for heart failure in adults with type 2 diabetes and diabetic kidney disease. This makes Invokana the only type 2 diabetes medication indicated to both treat diabetic kidney disease and reduce the risk of hospitalization for heart failure in patients with type 2 diabetes and diabetic kidney disease. In the United States, 1 out of every 3 people with type 2 diabetes has diabetic kidney disease, which adds to the risk of cardiovascular complication including heart failure and death. And it puts the patients on the path to dialysis and eventually kidney transplant. On top of that, heart failure is one of the leading causes of hospitalization. The new indication is based on results from the Phase 3 Credence study in patients with type 2 diabetes and diabetic kidney disease. It was actually stopped early because Invokana demonstrated a 30% reduction in the risk for end-stage kidney disease and a 39% reduction in the risk of hospitalization for heart failure. On September 27th, the FDA approved rituximab, that's brand name Rituxan, to treat granulomatosis with polyangiitis, that's GPA, and microscopic polyangiitis, MPA, in children 2 years of age and older in combination with steroids. This is the first approved treatment for children with this rare vasculitis disease, in which a patient's small blood vessels become inflamed, reducing the amount of blood that can flow through them. This can cause serious problems and damage to organs, most notably the lungs and the kidneys. This was approved by the FDA under priority review and with orphan drug status. The most common side effects of Rituxan are infection, infusion-related reactions, low levels of lymphocytes in the blood, and anemia. Healthcare providers should be advised to monitor patients for tumor lysis syndrome, cardiac adverse reactions, damage to kidneys, and bowel obstruction and perforation. Rituxan includes a boxed warning to draw attention to a number of risks, including fatal infusion reactions, potentially fatal severe skin and mouth reactions, hepatitis B virus reactivation that may cause serious liver problems, including liver failure and death, and progressive multifocal leukoencephalopathy, a rare serious brain infection that can result in severe disability or death. And that's all I have for this week. I hope you enjoyed today's episode. I'll include all links and resources in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you listened to today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. I hope you enjoy the rest of your day. Music by Joseph McDade.